Hey there, welcome to Autism and Beyond, and it's always a pleasure to have you. So this week's video was inspired by one of my clients who has a son, a 5-year-old boy, who has always been a good sleeper at night. And then now all of a sudden, the last 2-3 weeks, this boy has been waking up at night or sometimes very early in the morning, and they'll just wake up to scream, and it will become so difficult for them to be able to calm this child. That means these parents have had to stay up at night, and of course they're still expected to go to work. So how do we handle such situations when they happen, and what exactly is the cause? Before we proceed further, I would want to welcome you to be part of the Changing the Autism Narrative movement, which is something that I'm really passionate about. And this, what it means is I'm going to be coaching parents on how best they can be able to bring up children who are on the spectrum holistically. Okay, we are going to do things that are very customized. So if you want to be part of this, please go ahead and fill in the Google Docs on the description box, and I'll be able to get in touch with you. So, what could be the possible causes of a child who was otherwise fine and now they have to wake up very early in the morning or at night and start screaming? Of course, being on the spectrum, the first thing that comes to mind is the sensory sensitivities. Yeah, so you need to understand, how does my child process their senses? And again, if this is something that you have not mastered yet and you're a parent on a child on the spectrum, I've done an online course, and please, I'm going to tag the link also in the description box. Go ahead and get that course. It has the details on how to know how your child processes their senses and what exactly you're supposed to do. Okay, so if for any reason something has changed in the way they sleep, in the weather, in the beddings, the noise, the light, okay, these are the things that can really make your child on the spectrum not be able to enjoy their good night's sleep. Then the other thing which happens to all children is actually nightmares and night terrors. And usually that age of 5 to 7 to 9 is very common with nightmares based on really what these kids watch during the day, what they hear, what they understand in their brain. Okay, so the difference between nightmares and night terrors is that night terrors usually they involve a lot of screaming in the middle of the night, and usually most of these kids do not even remember if that thing happened. Okay, so this also can happen to children on the spectrum. The other thing is just because maybe they could be having some pain or some discomfort. I mean, if you're in Kenya, you'd appreciate the fact that we have had this influenza wave and COVID wave and RSV wave. It's like they all come together, and a lot of kids are in so much pain. The ears, the nose, the throat. Then the other thing is maybe your child is actually developing sleep disorders. We do know that insomnia is one of the commonest presenting symptom or sign for children on the spectrum. Most of these kids are insomniac. Okay, so maybe is it insomnia catching up with this child? And then last but not least is the difficulty in transitions. So sometimes you find as the child grows older, they start having this fear of, oh my God, I'm going to sleep. What's going to happen at night? Will things come? They start having all these things of monsters and all that. It's usually around that age. So what you need to help them is transitioning. Okay, you may need to, the bedtime routine, as we are going to discuss as the strategies, the bedtime routines have to be done a bit differently. The first thing I would want to mention out to you is that if you have a child who was otherwise okay, and then all of a sudden they start having all these challenges in their sleep, the first thing you need to keep is what we call a sleep log. A sleep log simply means you tracking the patterns of their sleep on each day. So try to see, did they sleep well? Did they not sleep well? And if yes, if no, what were they wearing? How was their day like? Did they watch something? Did they do something? Is there an activity? Did they go somewhere? So really you're trying to see, is there a pattern of them waking up at night or screaming at night? Is there anything that could have been a trigger during the day that will make them not be able to have a good night's sleep at night? And the first thing that you need to now check is, how is their sleep environment? As we said, one of the commonest triggers or causes could have been their sensitivity, in their sensory processing. So the first thing you need to look at is their sleepwear. Is it soft enough? Is it hard enough? Depending on how they process their senses. The labels, could the labels be the things that are hurting them? Okay. For example, you've bought new fabric, maybe there's a new beddings. Are there smells in that room that you don't know about? Okay. So that's the first thing. And then the second thing is how comfortable is the sleep area? The blankets. Do we have toys? The things that can comfort them. The blankets, the toys, stuffed animals. are these things that you could possibly incorporate into their sleep so that they are able to actually enjoy their sleep. And then the third thing is just the general environment. How is the lighting in the room? Is it possible you can have blackout curtains? Could you be able to put up white noise before they go into sleep, or even as they fall asleep? Can they be able to wear earplugs? For example, you live in a place that's relatively noisy. You may really want to invest in some noise cancelling earbuds, or even just earbuds to make them be able not to hear whatever is happening outside the environment. Okay. The second thing is, how do you put this child to sleep? Okay. How consistent is your bedtime routine? As we know that our children thrive in consistency. Okay, so is there bathing? Is it eating? What do you do? What do you normally do? The things that I can tell you for free is the fact that you should not be eating at least 2 hours before bedtime. Okay, because when your tummy is too full, sometimes that may affect the quality of sleep. And this is not only for children on the spectrum, but this is for everybody. Okay, do you prefer to sleep with the lights that are dim, or do you like the lights that are super bright? Or do you completely switch off the lights? Okay, do you prefer that your child sleeps with some music playing in the background? As we said, white noise can really come in handy at this particular point in time. So the bedtime routine has to be consistent. Okay, so I know with time, as your child learns to fall asleep by themselves, there are things that you may take for granted. But when such things happen, like now them not being able to sleep as much, you may really want to go back on the consistency of a bedtime routine. And then of course the other thing you should not forget is the screen time. Especially now the kids at home, especially if you're in Kenya, kids at home on holiday, and so you find a child watching maybe telly, or they're on their games or their lap tablets for up to 10 p.m. and then you expect just for them to just go to bed and fall asleep. It won't happen. Even for the neurotypical, sometimes they'll have to struggle a bit. Okay, so if your child is on the spectrum, whether they're on holiday or not, please do not interfere their bedtime routine. The third aspect, as we are saying, in the matters of nightmares and night terrors and the anxiety that come with transitioning them to go to sleep, is the managing of the anxiety, the sleep anxiety. Okay, so you need to keep on talking to your child, like reassuring them that they are going to fall asleep, and when people fall asleep, nothing really happens, and they are going to wake up the following day. Okay, because as they grow older, they start having these ideas of, oh my god, when I fall asleep, what is happening? Okay, so you really try to reassure them. You can use social stories. As if you have not watched my previous video, please go ahead and watch. It's one of the skills to build social skills. And what social stories are is you tell them before the situation. It's like short stories that make them understand. People fall asleep, and then when they say maybe they go to dreamland, and when they go to dreamland, they may be remembering what was happening on the day, a previous day, or maybe 2 days ago, so that when they wake up, they are not really frightened and anxious of what has just happened. Okay, that's the whole idea of managing their sleep anxiety. There's something called gradual feeding, of which is like the way we used to do baby training, sleep training for our infants. So you put them to sleep, but tell them that actually I'm here on bed with you, as I want you to fall asleep, but I will not sleep here. It's important for you to tell them that you'll not actually sleep with them there, because sometimes they sleep knowing you're there, and when they wake up, they actually find you're not there. They'll wake up and not be able to find you there. Maybe they'll start crying. You just go there. Again, what you do is reassurance, because this is sleep anxiety. Just reassure them, talk to them, calm them down. And again, so you'll have to repeat that. You fall asleep while they're there, and then you'll have to leave. So of course, this is a process. It's not like an event. It's not, you're not going to do it like once and then they'll be able to get it. No, it's gonna be a process. So be patient with them. Remember to act from a point of really understanding and calmness. I know it's not easy to be woken up at 2 a.m. in the morning and you'll be able to maintain your calm, but for the sake of this child and them learning the whole thing, try to, as much as you can, to be as calm as possible. The fourth thing is, we should never be able to, again, as Imbaroti said, one of the causes could be actually the discomfort and pain. So you need to always remember to rule out medical problems. So if this child was otherwise okay and now they're screaming, the first thing you need to do is make sure that go to hospital and confirm there's actually nothing wrong with this child. They could be in pain. Maybe they have ear pain, they have throat pain, especially for children who are nonverbal. It may be difficult for you to be able to pick if they're even, maybe it's even constipation, because that's also one of the very common things in children on the spectrum. Okay, so remember, maybe this should be the number one. Rule out any medical problems. Okay, confirm that this child is actually fine. And once you've been able to confirm this child is actually fine, that's when you do all these other things that we've been able to explain. Okay, because if this child is in pain, it doesn't matter what you do. The fifth thing is that you've done all these things and you feel like, oh my god, I'm getting overwhelmed, I'm not able to function during the day because of this interrupted sleep. And maybe if your child is school going, they're also not able to function. One of the things we may need to consider is magnesium supplements, which is usually it's a good supplement to produce the sleep hormone, but also you can also opt for melatonin, which is actually the sleep hormone. Okay, you should not do this as over the counter. Okay, please, before you opt to go for this, remember to consult your pediatrician. Go through that process together, go through that experience together. Once they think, okay, I think you've done everything you can and this is not going away, then it's okay. They'll be able to prescribe for you the melatonin and the magnesium supplements. Okay, now depending with the age, what I usually say is don't over rely on these. You can do magnesium because it's a supplement. Of course, if you're doing any multivitamins, magnesium is part of it. But for melatonin specifically, I would say do not over rely on this. Remember, the behavior therapy is also very, very important, of which your pediatrician will be able to recommend. So thank you. Just as a reminder, if you're watching up to this time, please go ahead and subscribe. 2 is, yes, if you don't know how your child processes their senses, please go ahead and buy the course. Trust me, it will go a long way. And the third thing is, please join in the Changing the Autism Narrative movement. Let us be able to parent our children in the most holistic way possible.